Hi, my name is Héctor Rosado. My topic is Hepatopulmonary Syndrome. Definition. Hepatopulmonary syndrome is characterized by defect in oxygenation due to pulmonary abnormalities associated with a loss in dyspnea and hypoxemia. Combination and after wash the appearance position.
Hepatopulmonary syndrome. It's a disease in the pulmonary caused by the hepato. So liver disease leading to pulmonary disease. The liver is cirrhotic. Cirrhosis leads to secretion of vasodilator material, cause the blood vessels to dilate. Okay, also this will lead to decreased oxygen going to the lung, leading to hypoxia. This is an oxygen tank and decreased in this patient. Also, you will have something called platypnea orthodeoxia. It's that the patient has dyspnea on sitting down, and this dyspnea may disappear when he lie down back on the bed. So this is called platypnea and orthodeoxia because there is hypoxia in this position. So this position is called platypnea and has hypoxia, so it's called orthodeoxia. So this is the triad of hepatopulmonary syndrome. You have cirrhosis, you have a patient with orthodeoxia or platypnea, and also there is hypoxia. How to diagnose? Contrast echo, and also you can use technetium albumin. Hepatopulmonary syndrome, cirrhosis, hypoxia, and platypnea. Diagnosed with contrast echo and technetium albumin.
Application in nursing. The nursing professional will have to assess and therefore pay special attention due to following aspects. Free-level alteration due to acid. Danger of bleeding due to hypopulation and osteoporosis virus. Nutritional alteration due to anorexia, dyspepsia, and metabolic dysfunction.
I am Michael Croca. I am a pulmonologist at the Mayo Clinic, and I do consultation in the liver transplant program, helping the liver transplant surgeons and the hepatologists deal with lung problems in the patients that are going to have a liver transplant. The topic today is hepatopulmonary syndrome, which is a very specific lung complication of liver disease. And this particular complication results in the patient being short of breath and having very low oxygen levels because of a very complex relationship between the liver and the lungs. Patients with hepatopulmonary syndrome generally begin with a liver disease, and over time they find themselves more and more short of breath. With chest x-rays it may be normal and no other major finding. They may note that their fingertips turn blue. They may note that their finger size becomes clubbed. And further evaluation suggests that indeed this syndrome may exist. We make the diagnosis by doing a sound wave test of the heart, which can assess whether or not there are pulmonary blood vessel abnormalities in the lung. And we also measure arterial blood gases, which gives us an idea of the actual oxygen level in the bloodstream. Once we make a diagnosis, it's very important to try to improve the symptoms, and we have the patients wear supplemental oxygen if indeed the oxygen level is seriously low. And more importantly, we try to define what the best treatment is. There are no medications that help with this syndrome to the best of our knowledge and our experience so far. The good news is, however, that with a successful liver transplant, all of these blood vessel problems in the lung that causes the oxygen level to be low do resolve and they reverse. And it may take many weeks or months after a successful transplant. But indeed, this does help the patient. It cures the syndrome, and the syndrome does not return as long as the new liver is working as expected. Most importantly, if the oxygen level becomes very low as part of the evaluation that we're doing during a liver transplant assessment, the patient can even get a higher priority for liver transplant. This is a new policy that's been put forth by UNOS. Again, it's for the patient's benefit, and the goal is to get a timely transplant so that the oxygen problem can resolve more quickly after the successful transplant. The resolution of the syndrome takes probably many weeks or months, and again, no medications help with this, and liver transplant is the treatment of choice in most of the centers across the United States. Mayo Clinic has extensive experience dealing with patients with this problem. We have consulted and managed over 100 patients with this particular dilemma, and I must admit the success rate in our program with our surgeons and hepatologists has been excellent to date.
Pros and cons. Cons. It is not yet known science has life alone. Diseases are related. Oxygen therapy is meant to attain for chest of breast cause below oxygen level in the blood. Issue applied in Ecuador. Hepatopulmonary syndrome generally occurs in patients with cirrhosis of the liver. Hepatic cirrhosis constitutes the definite stage of the disease, chronic liver disease. Conclusion. In conclusion, hepatopulmonary syndrome is a complication that it occurs in certain life. It is more frequent in patients with liver cirrhosis of any cause. Thank you.